Welcome to Shalonda's Nursing Corner, your go-to place for nursing education and NCLEX prep and high-yield topics. If you're new here, don't forget to like, subscribe, and hit that notification bell so you don't miss out on future nursing content. Diabetes mellitus is a chronic metabolic disorder that affects how the body processes glucose. The two major types are type 1 and type 2 diabetes, and knowing the differences is crucial for the NCLEX. Type 1 diabetes is an autoimmune disorder where the body attacks the insulin-producing beta cells in the pancreas. This results in little to no insulin production, making insulin therapy essential for survival. Classic signs: the 3 Ps, polydipsia, polyuria, and polyphagia. If you see these on the NCLEX, think type 1 diabetes. Type 2 diabetes is caused by insulin resistance. The pancreas still makes insulin, but the body's cells don't respond properly. Over time, insulin production may decrease. Risk factors include obesity, poor diet, sedentary lifestyle, and family history. Management? First-line treatment is lifestyle modifications, healthy eating, and exercise. Oral medications like metformin are common, but some patients may need insulin therapy later on. Quick NCLEX tip: remember, type 1 equal to no insulin equal to insulin dependent. Type 2 equal to insulin resistance equal to lifestyle plus meds first. If the NCLEX question asks about a child or young adult with sudden weight loss and the 3 Ps, think type 1 diabetes. If it's about an older adult with obesity and a sedentary lifestyle, think type 2. Now it's time to test your knowledge. Try these NCLEX-style questions and check your answers below. Question: a newly diagnosed patient with type 1 diabetes asks why they need insulin injections. The nurse's best response is: A. Your pancreas still produces some insulin, but not enough. B. Oral medications are not effective for your type of diabetes. C. Insulin helps to dissolve extra glucose in your bloodstream. D. You only need insulin when your blood sugar is over 200 mg per deciliter. Explanation: type 1 diabetes results from an absolute deficiency of insulin. Oral medications are ineffective because they rely on the body's ability to produce insulin, which type 1 diabetics lack. Question: which of the following patients is at highest risk for developing type 2 diabetes? A. A 25-year-old athlete who runs daily. B. A 45-year-old office worker with a BMI of 32 and a family history of diabetes. C. A 30-year-old with type 1 diabetes since childhood. D. A 70-year-old with no history of blood sugar issues. Explanation: risk factors for type 2 diabetes include obesity, family history, and a sedentary lifestyle. A BMI over 30 significantly increases the risk. Question: a patient with type 1 diabetes reports feeling shaky, sweaty, and confused. What is the priority nursing intervention? A. Administer insulin. B. Give 15 grams of fast-acting carbohydrates. C. Check the patient's urine for ketones. D. Call the provider immediately. Explanation: these symptoms indicate hypoglycemia, a dangerous complication of diabetes. The priority intervention is to follow the 15-to-15 rule. Give 15 grams of fast-acting carbs, wait 15 minutes, then recheck blood glucose. How did you do? Let me know your score in the comments below. If you found this helpful, like, subscribe, and share with your fellow nursing students. See you next time on Shalonda's Nursing Corner.